The Ketogenic Diet, Beneficial for More Than Just Weight Loss, presented by Shanika Baylor. Current guidelines recommend a low-fat diet, which consists of less than 30% of calories from fat, approximately 20 to 25% of calories coming from protein sources, and the remainder of the calories coming from carbohydrates, mainly whole grains, fruits, and vegetables. Guidelines also recommend that in order to decrease weight, calories should be decreased, namely the calories from fat that are being consumed. What is the ketogenic diet? The ketogenic diet has become very popular over the last few years, and it differs from the low-fat diet in that the majority of calories come from fat. Approximately 65 to 75% of calories are going to come from fat, with 20 to 25% coming from protein and less than 10% coming from carbohydrates. People will often refer to eating no more than 30 net carbs per day. Net carbs are going to be the amount of total carbohydrates minus the fiber content in the food that you're eating. The ketogenic diet restricts whole grains and other refined carbohydrates and encourages eating low carbohydrate vegetables like broccoli, cauliflower, and spinach. So how does the ketogenic diet work? As you decrease the amount of carbohydrates you eat and increase the amount of fat, your body will enter into a process called ketosis. At this time, the body begins to produce ketones and will use extra fat for energy. On the left, you can see what a keto food pyramid looks like in comparison to the current food pyramid. As you can see at the bottom of the keto food pyramid, things that are currently recommended in abundance in the current guidelines are excluded in the ketogenic diet. The ketogenic diet and weight loss. Several trials have been conducted and shown that the ketogenic diet is effective for short-term weight loss and that this weight loss can generally be sustained for at least 1 year. In one trial, participants lost about 30 pounds in 12 weeks without a restriction on the amount of calories that they consumed. In a second trial, where the calories were reduced for 2 weeks and then the calories were unlimited for the next 10 weeks, men lost approximately 40 pounds and women lost 24 pounds. When compared to low-calorie dieters, there was a 12% decrease in body weight in the ketogenic group and only a 6% decrease in body weight in the low-calorie group. In an online dietary intervention, those on the ketogenic diet lost about 30 pounds, and those who used the plate method for weight loss only lost about 6.5 pounds in a total of 32 weeks. Finally, when compared to low-fat dieters who consumed the same amount of reduced calories as the ketogenic group lost about 32 pounds and the low-fat group lost about 25 pounds. These results were sustained after 1 year. Heart health and the ketogenic diet. Oftentimes, people wonder if a diet high in fat can be heart healthy. The ketogenic diet has been shown to have positive effects on heart health, which leads to a decrease in heart disease risk. Several studies have shown that the ketogenic diet increases your HDL or good cholesterol while also decreasing triglycerides and total cholesterol. Several studies have also shown that those on the ketogenic diet have a decrease in their overall blood pressure. Ketogenic diet and type 2 diabetes. In people with type 2 diabetes, the ketogenic diet was shown to not only decrease weight, but to also decrease blood sugars and decrease A1C. One study showed that greater than half of the participants on the ketogenic diet decreased their A1C to less than 6.5%, which is the cutoff for prediabetes. In another study, those on certain diabetic medications either had those medications doses reduced by half or stopped before the study, and they were successful in still decreasing their blood sugars and decreasing their A1C to less than 6.5%. When participants continued on the ketogenic diet, they were able to sustain their A1C and the need for less medications. Inflammation caused by obesity can lead to heart disease, diabetes, and other conditions that affect the body. Two of these inflammation markers were examined in dieters on the ketogenic diet, and both markers were found to be improved on the ketogenic diet. Is the ketogenic diet safe for adolescents and teens? General recommendations for overweight and obese adolescents and teens have been the same for adults. Follow a reduced calorie, low fat diet to create weight loss. One study looked at otherwise healthy, overweight, and obese teens and compared the effects of a low fat diet with the ketogenic diet. The ketogenic group lost about 22 pounds in 12 weeks, while the low fat group only lost about 9 pounds. This weight loss was despite the fact that the keto group consumed more calories than the low fat group. They also found improvements in HDL and that in a 1-year follow-up, 50% of the participants from the ketogenic group have maintained their weight loss. So all that sounds great, but what about side effects? One study showed bad breath, aka keto breath, constipation, and dry mouth as the major effects when first starting the keto diet. In most, these effects resolve within a few weeks to a month. So what's the bottom line? The ketogenic diet has been shown to be a safe, long-term, viable option for weight loss in men, women, adolescents, and teens. It is effective in improving overall health and decreasing disease risk factors.